Most of the time in our daily life, the dental healthcare professionals or we dental surgeons will be the first person to be called upon by a primary healthcare center or hospital to attend a case of bleeding from the oral cavity, especially in NOP times. So this type of cases are very common in our daily life. A patient presented with severe bleeding inside the oral cavity, which might be sudden in onset or might be started since yesterday. So this is very important for us to know, especially the undergraduate and the postgraduate students who is learning the industry, how to manage a patient who comes with bleeding disorders to you and identify what is the real cause or the etiology which causes this bleeding, whether this bleeding is acquired or it is inherited or due to any deficiencies of clotting factors, something like that, or due to any systemic diseases. So this type of diseases or disorders are actually very common in our daily life. So when I remember during my PG life, I had a similar case of bleeding patient. So at around 2 to 2:30 p.m., a patient came to us. I remember his name is Satyananda, a 17-year-old boy who came to us with a complaint of severe bleeding from the oral cavity. So he actually reached to us at a time of 2 to 2:35 p.m. So he gives a history of attending a marriage at around 1:30 p.m. with his friends, and he started eating chicken biryani. So while having chicken biryani, he had a bite on the bone of the chicken, and followed by he felt a small pain on his parietal region, which is the prime factor for the bleeding. So slowly the bleeding started. Oh, actually, the first times he actually neglected that bleeding, and meanwhile he started eating the chicken again. And after few seconds, he felt something like a ball-like thing inside his oral cavity, and he actually spit it out. Then he saw a large ball of blood. Actually, it's a part of blood flow which came out of his mouth. Then, when his friends looked into his oral cavity, they found that there is a small bag-like thing actually oozing and which was moving from the parietal side. So they got panicked and they took the nearby auto rickshaw and came to the dental college and visited us. So during the first visit, we have examined the patient and we can see, I can show you the next PowerPoint presentation of the same case. So during the presentation, he was like a very thin guy, around 5 to 5'10" height inside the oral cavity. We can see small blood stains are there inside the lips and around the lips and the corner of the mouth. So we made him to sit in the dental chair, and the bystanders had given us the history regarding the incident. And we have looked upon to his oral cavity, and we found out the same bag-like blood was oozing, and it was like hanging from the palate. So with a gauze piece, we have wiped out that. Then again started a small bleeding like thing was coming from that wound which was happened on the palate due to that chicken bone, and the blood was actually again coming. And slowly it started becoming like a bag-like thing which is hanging from the palatal side. So that was actually an unusual thing and not a normal or common thing to see in the daily OP life. The first thing we have advised the patient was to go for a thorough blood checkup. So we have advised the patient to go for hemoglobin, RBC, WBC, platelet, DSR, all the normal routine blood investigation. And within 1 hour, the blood investigation report came, and we have found out that the WBC count was more than 40,000. So that gives us a chance that the patient might be having an enormous number of WBC, white blood cells counts in him. That gives an alarming factor that he might be having blood cancer or leukemia. On further investigation, we found out that the patient was having chronic myeloid leukemia, and we have referred the patient to higher center and especially to Vellore because it was easy for us to transfer the patient to a higher center, and Vellore was near to us because I have studied my PG life in Vellore. So like that, after my PG life and even in my teaching career and in my clinical practice also, I have found many cases of bleeding and clotting disorders. So anyone can expect anytime a patient presenting to you with a history of bleeding. And even though if nobody is presenting to you with a history of bleeding, a procedure done by you might end up in severe bleeding if you did not take a proper history regarding the patient's previous or the present systemic disorder. Because many of the patient at this present era is usually under many systemic disorders, especially the anti-platelet drugs, anticoagulant drugs, diabetics, hypertension, and any liver disorder. All these things have a risk factor for causing severe type of bleeding, especially when you, because the most common dental procedures in all the dental clinics will be obviously extraction. So when you start with an extraction procedure and if you do not take a proper history, especially the drug history and the medical history, you will end up seeing that you cannot manage a patient with severe hemorrhage followed by dental extraction, and finally the patient will be undergoing shock and death. So this is very important topic for you people to understand how to identify a patient with disorders, especially the bleeding and clotting disorders. And in case if you found something like that, you have to identify the factor which causes this bleeding and clotting disorders and how to manage it clinically. So I can share you a few PPT presentation regarding that. And we'll start with that and don't get panicked by seeing these images and presentation, because this is very important and terrific topic for you to understand. That's why we have kept a video things like this. And by definition, by the theory definition, usually the first thing we have to keep into mind is hemostasis. So what is mean by hemostasis? Hemostasis is actually called as the physiological process of stopping or arresting the bleeding while maintaining the normal internal blood equilibrium. That means, for example, a normal healthy individual who had a wound or a cut, or we have done an extraction to a patient, or there is a small ulcer or a wound formed inside the oral cavity. From the wound, the bleeding starts, and how the bleeding will stop without making any problem to the internal equilibrium of the body. So this is a very basic mechanism and very important mechanism for you people to understand. So for that, I will show you one video. You can understand the mechanism of how the bleeding mechanism and the clotting mechanism works, how the extrinsic mechanism and intrinsic mechanism, how the clotting factors, what are the roles of clotting factors, how the clotting factors will help us to promote this hemostasis mechanism. If you remember from the beginning of your first year undergraduate till the final year, most of the subjects, let it be the physiology, biochemistry, the second year pathology, all pharmacology, whatever it is, when you come to the apply clinical practice of your general medicine, general surgery, everywhere you deal with blood and hemostasis, because basically we all are actually surgeons, dental surgeons. So this is very important for you to understand the mechanism of hemostasis. So we'll start with a video that will actually show you how the mechanisms of hemostasis works. So for this purpose, I will just reduce the my video to small so that it will be easy for you people to understand. Yeah, fine. I think you can see now. So whenever a damage occur to a blood vessel or any part of the body, this damage itself will result in a reflex mechanism of vasoconstriction. So this vasoconstriction will definitely result in reduction in the flow of blood flow. That you can see that whenever there is a damage, there is a reflex action happening, and this reflex action resulted in the narrowing of the blood vessels, in turn, which results in the reduction of blood flow. That is one thing. The second thing, during this damage area, you can find small collagen things that exposed. To this collagen, which was exposed due to damage, the circulating platelet start getting adhered to this area. So this is the part where you can find the platelets start getting adhering to this exposed collagen fibers. When many of these platelets start adhering to the collagen fibers which was formed due to this damage, These adhered platelets will undergo degranulation. So degranulating these platelets will result in release of cytoplasmic granules like the chemical mediators like serotonin, and there is something called as ADP and the thromboxane A2. So this serotonin itself will result in aggregation of more platelets to these damaged collagen blood vessels, and ADP and thromboxane active will continue the degranulation process, vasoconstriction, and also will attract more and more platelets to these exposed collagen fibers. That is the first thing, and finally there will be formation of a platelet plaque in the area of damage. So that is the first thing. Then comes the final stage of hemostasis, where the main role of internal and external equilibrium and all these things will happen. So the damaged blood vessels, as we said earlier, will result in the release of factor 3. So factor 3 in turn with the help of calcium ions will activate the factor 7. This is the formation of extrinsic mechanism in hemostasis. In the next stage, the factor 12, this will result in then the activation of factor 11. And there comes the intrinsic mechanisms of hemostasis. So now both the extrinsic and intrinsic mechanisms take part, and all these factors with the help of factor 11 and the factor 7, they will activate factor 10. So factor 10 with the help of factor 3, factor 5, calcium, and other plasma thrombin factors, in turn will activate the factor 10 to promote prothrombin activator. And the prothrombin activator, in turn, will result in the activation of prothrombin to thrombin. So now we are going to the final stage. So from thrombin, this thrombin will convert the fibrinogen into fibrin. So the fibrin, which is actually formed in the last stage of hemostasis, you can see here, this is actually a loose mesh of fibrin which is formed in this type of area. So to stabilize this loose mesh of fibrin, the 13th factor, that is the fibrin stabilizing clot factor, this 13th factor will activate and will in turn convert this loose type of fibrin into much more stronger mesh-like thing. And to much more stronger mesh-like thing, these same circulating RBCs, platelets will start getting adhered to this area, and finally they will form a big mass of blood clot. So remember, I have told you in my story what I have mentioned regarding the history of once again. I'll come back to that video session. Fine. Now it's clear. So I hope you understood the mechanism of hemostasis. So like last, the story what I have told you, I have already mentioned that the blood clot which was oozing and hanging from the palate of that hemophilic patient, no, sorry, the patient who suffers from leukemia. So these are the most important clotting factors which is present. There are actually 13 clotting factors. From factor 1 to factor 30, each factor is having their own role, and you can see that factor 4, this is called as the calcium. So calcium is having a main role. Calcium acts as most important ion which is necessary for the bone and teeth. Also, this is also considered as an important clotting factor. And many of the clotting factors are actually produced inside the liver with the help of vitamin K. So a patient who is actually have a deficiency of fat soluble vitamin, especially vitamin K, will end up in clotting disorders or bleeding disorders. A patient who is having liver disorder also will end up in this problem. There is a Malayalam movie called as Spirit, which is acted by Mohanlal. There is a scene where a chronic alcoholic is actually going to death by spitting and vomiting a large volume of blood. That is basically because the alcohol, a chronic alcoholism, will definitely damage the liver. Since the liver got damaged, all the clotting factors which is responsible for this clotting mechanism production are also stopped. So this in turn will result in severe bleeding, and finally the patient will undergo shock, coma, followed by death. And factor 8, factor 9, and all these things are very important. They are called as the factors which is responsible for the disease called as hemophilia A, hemophilia B, and the deficiencies of this is very important. And since the child is born, most of the clinicians or physicians can understand that the baby might be actually have a deficiency of these factors. But not only for the child, even many cases were there. Even in my, I heard many stories regarding my PG life that an MBBS guy who doesn't know that he is actually suffering from the deficiency of hemophilia. He went for an extraction, and since the dentist took a proper history regarding his medical and all the systemic conditions, and actually the MBBS student was actually not aware that he is actually having a deficiency of hemophilia. So he underwent the extraction of a molar and impacted tooth. He went back to his room, and slowly what happened was he slept off, but it ended up in going for a small bleeding from the damaged blood vessels happened during extraction. Since there is a deficiency of factor 8, and slowly, the blood oozes out, and the patient went to hypovolemic shock, and finally the student ended up in death. So that is something which is very rare to happen, but many stories are like that also. So something we can, there are certain tests which will be help us to identify many types of clotting and bleeding disorders. And one of the most important tests is called as tourniquet test. See, you can see some points. This tourniquet test is helps to evaluate the integrity of the vascular system, and there is they have mentioned about the BP cuff, all these things. And the last in an yellow letter, I have mentioned something about the Rampelli phenomenon. I will explain to you this one. See, this tourniquet test. This test is very easy for dental surgeons to do in a chairside setup or scenario. Most of the developing countries, any developing or third world countries, or in some rural areas where there is less feasibility for blood investigation or something like that, or the places where the incidence and prevalence of dengue diseases are very common. See, dengue itself is called as a hemorrhagic fever. So to rule out whether the patient is affected with dengue or not, or the patient is having any hemorrhagic type of disorders, we be usually doing this type of test. And for this test, we actually only required only two instruments. One is a stethoscope and one is a sphygmomanometer. Stethoscope and sphygmomanometer is very common. That is easily available in most of the primary healthcare centers, in our dental clinics, dental colleges, and even any of the areas. These two things are very most commonly available. And you can see in that picture, the clinician is showing to an area. I can show it to my fingers that, see, this area is actually called as antecubital fossa. So take this antecubital fossa as one thing. From this antecubital fossa, you have to measure, go above a 2 to 3 inch place to here, and from this antecubital fossa, go back to about 2 to 3 inches and place your sphygmomanometer handcuff here. This is the normal procedure. So after placing your sphygmomanometer handcuff here, slowly inflate the sphygmomanometer and identify the systolic and diastolic pressure of that patient. And when you found out that, for example, you carefully listen to this example. When you found out that the patient's blood pressure systolic, say, for example, it is 120, and diastolic is 80 mm of Hg. So 120 by 80 mm of Hg is this patient's normal blood pressure level. So you are going to note down the normal blood pressure level of this patient is 120 by 80 mm of Hg. Followed by this, the next step, what you are going to do is you are going to deflate the sphygmomanometer. After deflating the sphygmomanometer, again after 5 minutes, wait for 5 minutes, followed by you have to calculate the mean pressure of that patient. How to calculate the mean pressure? I have told you that the patient's systolic blood pressure is 120 and the diastolic blood pressure is 180. So to calculate the mean pressure, it is easy. 120 plus 80, that comes 200. And 200 divided by 2 means 100 is the mean pressure of that particular patient where we have checked for BP. So take 100 mean pressure as the present mean pressure of this patient. And again, you are going to inflate the sphygmomanometer again. This time you are going to inflate the sphygmomanometer and you have to keep the blood pressure at 100 level. Maintain the same 100 level pressure in your sphygmomanometer scale for again for the next 5 minutes. So when you keep this for 5 minutes, after 5 minutes, deflate your sphygmomanometer. Very important point to take into consideration during this thing is that your stethoscope will be having two parts. The down part is called as the diaphragm and the upper portion is called as the bell. So you are going to check your BP with your bell portion and don't press it with your diaphragm because we are going to find out the integrity, the vascular vessel wall integrity of that patient. So we have to give minimum pressure with any type of instrument where we are going to check your BP. So for this purpose, we are only going to take the bell portion of the stethoscope for checking the BP. That is very important finding. So as I said earlier, take time of 5 minutes, inflate the sphygmomanometer to that particular patient by taking the patient's mean blood pressure. Now for our patient, it is actually 100 mean pressure. Keep the thing and maintain it for the next 5 minutes, then deflate that. Following your deflation, you check for the presence of petechiae. This is called as petechiae. Small hemorrhagic spots which is formed on the patient's skin is called as petechiae. And this type of petechiae is very common when the patient is having any type of damages or disorders to their vessel wall. Especially this type of things are very common in patients with dengue hemorrhagic fever or any patients with any vascular integrity disorders. And when you go to very old age patients, this type of things are very common inside their oral cavity also. Because whenever the patients started undergoing aging, the blood vessels, the strength and the thickness of the blood vessels will start undergoing declining. So the blood vessels will become more thinner. This thinness will actually show you like a mirror type effect of the blood flowing within you. So the pigments, all these things will be visible outside. And when you find this type of things inside a patient's oral cavity of more than 60 to 70-year-old age, that is called as senile purpuric lesions or senile purpura. That is usually a physiological finding seen in an old age group. So coming back to our topic, so when you find something like this after deflating your sphygmomanometer, check you are supposed to draw a 2.5 centimeter circle on that area. Within that circle, count the number of petechiae it is easily visible. And if you found more than 20 number of petechic spots within that 2.5 circle diameter, that means your tourniquet test is positive. Got it? And if you found less than 20 points of petechial spots, that means your tourniquet test is negative. So this finding is called as rumble lead phenomenon, and this test is called as tourniquet test or also called as capillary fragility test. And there is one more name called as Hess test, HESS test. So this is a very most common and in the chairside investigation, even any dental surgeon, any undergraduate students, if you suspect or anything, you can easily do by making the patient to sit in a dental chair with the help of a sphygmomanometer and a stethoscope. And before performing these things, always many classes I used to tell that inform the patient before performing anything. So when you make the patient to sit, most of the patients are very well aware regarding how to check the BP. Even patients also knows nowadays how to check the BP. So it is your responsibility to inform the patient that you are actually not checking the BP, but this is a test which is used to identify is there any disorders or any vessel walls integrity problems for you. So always inform to the patient before performing any type of procedures. Okay. So I hope this is clear. And this is one of the most common time test. This is called as bleeding time test. This is the time which is taken from oozing of a blood from a fresh wound till the arrest. So in the first year physiology, the practical classes, most of them will be aware regarding this case. The normal scenario it will be usually 1 to 6 minutes. Two types of methods are there, Duke and IV method. And during our physiology classes, I think we have done the fingertip test by just giving a prick on the test, and we'll find out how much, what is the duration of bleeding from that prick we have done, and we'll be counting in seconds or minutes. And normally it will stay within 5 to 6 minutes. The next thing is platelet count. Platelet count will actually determine the presence of increase and decrease in the number of platelets. So, the platelet is one of the most important cells, which is very important in the case of bleeding and clotting scenarios. And in the hemostasis mechanism, you have seen that to the exposed collagen fibers, platelets are the first thing which comes and actually adhere to that area. And all the procedures actually start from a single platelet. Platelet is the one which is actually releasing the cytoplasmic granules. Platelet is the one which is actually attracting the other platelet to that area, and finally the blood is actually clotting in that region. So whenever there is a platelet count which is very much below than the normal level, the body will start showing the inside hemorrhage, or that is one feature in dengue fever, dengue hemorrhagic fever. The normal count is usually 1,50,000 to 4 lakh, and you might be knowing about many diseases like thrombocytopenia, idiopathic thrombocytopenia purpura. All these things are actually associated with platelet disorder, and there are certain drugs which actually results in destruction of the platelet. And remember the NSAID, non-steroidal anti-inflammatory drugs like aspirin. The main action of aspirin itself is to the irreversible destruction or the break of the production of platelet. That's why whenever a patient is coming to this, aspirin is one of the most common drug, not only aspirin, even the other antiplatelet drugs like clopidogrel. All these things are one of the most common antiplatelet drugs used by many of our patients. So always ask the history regarding whether these patients are using these antiplatelet drugs or not. And in case if they are using and if their medical condition is fit, or sometimes you might need the consent from a medical physician or a cardiologist regarding the health status of that patient. You need to write a letter to the physician, ask about the consent regarding the stoppage of platelet antiplatelet drug for 4 to 5 days, followed by the extraction of any surgical procedures you want to carry on to that patient. So it's very important for you to consult the patient physician during very important times. So don't neglect that and don't be very lazy for you to write a letter to that their clinician, because after all you should not be a person who is responsible for that patient to undergo bleeding and death. Got it? And clotting time. Clotting time is the time taken for the blood to clot after collecting it from the body. Intrinsic clotting factors are very important, and we usually clotting time. You people remember in physiology we used to have a small tube-like method, and that capillary tube will be keeping into that bleeding spot, and slowly the blood will be using inside that capillary tube. We'll wait for them. After that, we'll be slowly breaking that capillary tube, and we feel that the small fibril-like things will be formed or not. This is the capillary tube method. And prothrombin time and INR. The full form of INR is International Normalized Ratio. These two things are very much important, and these two things are interconnected. So the prothrombin time indicates the total number of prothrombin which is present inside the blood. And international normalized ratio is actually done to normalize the amount of prothrombin which is present inside the blood. So to normalize that, we have added thromboplastin and calcium to the patient's serum, and it is actually expressed in ratio. This is called as international normalized ratio. So a prothrombin time is normalized tissue specific ratio for easy identification. And for that purpose, to normalize it, we are adding thromboplastin and calcium to the patient's serum. So the normal prothrombin time will be usually 11 to 13 seconds, and the international normalized ratio will be within 1 to 2. This will actually help us to evaluate the integrity, the availability, and the production of extrinsic system and the clotting factors like 1, 2, 5, 7, and 10. So you might be seeing in many type of medical prescriptions that most of the patient who is going for surgical procedure, they might be sending the patient for checking the INR ratio, because this is usually done to standardize the prothrombin time. Then comes the activated partial thromboplastin time. This will actually test the intrinsic and common pathway, and it will help to identify the activity of factor 8, factor 9, factor 11, and factor 12. And in this case, the caveolin is actually added to the patient plasma to standardize that, like our prothrombin time. To standardize the prothrombin time, we are adding the ingredients which has been shown in the last thing, like thromboplastin and calcium, like that. Caveolin is added to the patient plasma here, and the normal value usually comes between 15 to 25 seconds. Then thrombin time, which is the ability to form the initial clot from fibrinogen. You remember the first video what I have shown, the thrombin will help to convert thromboplastin into fibrin to fibrinogen. So it is the ability of the initial clot to form from fibrinogen. So the thrombin is added to plasma, and the time taken to the clot is actually noted by this. So the normal time taken for the thrombin after adding into the plasma and for the formation of clot is within 9 to 13 seconds. So coming to the classification, I hope we'll continue the class in the next session. So we'll start with the classification in the next class. So you people have to be thorough regarding the mechanism of hemostasis, how the hemostasis mechanism works, what is the definition of hemostasis, that is one thing, and how the intrinsic and extrinsic pathway of hemostasis works. 13 clotting factors, we should be well aware regarding the 13 clotting factors, its function, and the basic bleeding and clotting test, disorder test. You should be very well aware that whenever you suspect any patient who is coming to you, who gives a history of clotting or bleeding disorders, you should be able to know which test you are supposed to send the patient for. So, and remember about the capillary fragility test. That test is very easy for us to do in the dental chair setup with the presence of a sphygmomanometer and a stethoscope. Then bleeding time, clotting time, thrombin time, national normalized ratio. All these things you people make a note for this, and the next class we will deal with classification of hemostatic disorders. Till then, bye bye.